Hydroquinone is a medication used to lighten dark patches of skin caused by pregnancy, birth control pills, hormone medicine, or skin injury. It is also known as hyperpigmentation, melasma, liver spots, age spots, or freckles. This medicine works by blocking the process in the skin that leads to discoloration. The recommended daily dosage and optimal timing should be determined by a healthcare professional. When using Elastiderm cream, make sure to follow the directions on the product package or as directed by your doctor. Before applying the cream, do a patch test on a small area of unbroken skin and check for any serious side effects within 24 hours. If the test area becomes itchy, red, puffy, or blistering, do not use the product and contact your doctor. If there is only mild redness, you may begin treatment with this product. Apply the medication to the affected areas of the skin, usually twice daily or as directed by your doctor. This medication is for use on the skin only, and if used incorrectly, it may cause unwanted skin lightening. Avoid getting the product in your eyes, inside your nose, or mouth. If it does come into contact with those areas, flush with plenty of water. Using this medication may make the treated areas of skin more sensitive to the sun. It is important to avoid prolonged sun exposure, tanning booths, and sun lamps. Use sunscreen and wear protective clothing on the treated areas of the skin when outdoors. To get the most benefit from this medication, use it regularly at the same times each day. If your condition persists or worsens after 2 months of use, be sure to inform your doctor. When using Elastiderm cream, you may experience mild burning, stinging, redness, or dryness. If these side effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. Discontinue use of hydroquinone and seek medical attention if you experience blistering, skin cracking, or blue-black darkening of the skin. While a severe allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects. If you notice any other effects not mentioned, it's best to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Elastiderm cream, it's important to talk to your doctor about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Make sure to inform your doctor or pharmacist about your medical history, especially if you have asthma or other skin conditions. If you are pregnant or breastfeeding, be sure to discuss the risks and benefits of using this medication with your doctor. And if you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to be aware of possible drug interactions when using Elastiderm cream. This can affect how your medications work and potentially increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines while using Elastiderm cream. If Elastiderm cream is accidentally ingested, it can be harmful, especially if taken in large amounts. If someone has ingested an overdose and experiences severe symptoms such as fainting, difficulty breathing, or seizures, it is crucial to seek immediate medical attention. In the US, you can call the local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Symptoms of ingestion may include shaking or tremors. It's important not to share Elastiderm cream with others. This medication has been prescribed specifically for your current skin condition, so it's not recommended to use it for any other skin problems unless advised by your doctor. If you need to treat a different skin issue, your doctor may recommend a different medication. If you happen to forget a dose of Elastiderm cream, use it as soon as you remember. However, if it's close to the time of your next dose, it's best to skip the missed dose and just continue with your regular schedule. Avoid doubling the dose to make up for the missed one. When using Elastiderm cream, it is important to store it at room temperature and keep it out of reach of children and pets. Do not dispose of the cream by flushing it down the toilet or pouring it into a drain unless specifically directed. Instead, properly discard the product when it is expired or no longer needed. If you have any questions about how to dispose of Elastiderm cream, consult your pharmacist or local waste disposal company for proper guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.